So you're going on a trip and you're wondering what medications you should bring to be ready for different circumstances that might arise. Well, let's talk about it. Now, side note before we get into it, although I've been a physician assistant in the ER for 23 years now, and I'm very familiar with all these medications, and I even have a trucker hat that says you can trust me, the stuff I say may not apply to you and your medical conditions and your allergies. So if you have any specific questions to you, speak to your doctor about that. All right, that said, let's have a chat. So if you're going on vacation, what you bring is going to depend on where you're going and how long you're going for. If, for instance, you're going 2 hours away for 2 nights, I think that's going to be a very different set of things you're going to bring than if you're going 2 weeks to the other side of the world to a third world country. If you live, for instance, I'm in Ohio. If I go 2 hours away, if I go to Columbus or Cleveland for 2 nights, well, if something comes up, there's probably an urgent care or an ER or a pharmacy I can get to. I may have a car. I'm probably still in civilization and I know how the medical system here works. However, if I'm going to Tanzania, third world country, I probably don't have a car. I don't know how the medical system works. I maybe don't trust the medical system. And if I'm somewhere like up on Kilimanjaro, there are no medical clinics on the mountain. So you need to be prepared for more. So it really just depends on where you're going. Consider your destination, how long you're going to be there for, and that will help guide what you're bringing. Now, also considerations, are you packing for just yourself or is it your whole family? And do you need to bring stuff for your kids? Do you need pediatric doses and liquid doses? This talk is mostly going to be centered on you packing for yourself, but those are also considerations. Now, for the medications, there are some that are going to be easy over-the-counter purchases, and there are some that will require a prescription. And you can go to your family doctor and say, hey, I'm going to Tanzania. Can we have a discussion about some things that might be helpful for me to bring? Or there are also travel clinics that will be well-versed in looking up different antibiotics and things you can bring or need to bring, and some other symptomatic medications they can help prescribe you with. There are several medications that you might want to bring that will do several different things, several different conditions, which is also useful. And then also, aside from the family thing, do you want to be prepared for just yourself or do you want to be prepared to help other people? And we'll talk about that as well. So first, on the classes of things, I think you should have a pain medicine. I've done a whole video on pain medications. I'll put a link to up here. You can check that out. But the big classes of pain medicines are NSAIDs, like ibuprofen and naproxen, brand names Motrin and Aleve or Naproxen. And those are anti-inflammatories. And then there is Tylenol or acetaminophen. And short version, you can take an NSAID and a Tylenol together. They work really well together for adults, for kids, but don't take 2 NSAIDs together. A third possibility, and again, this is, do you want to be prepared for just yourself or do you want to help other people? I don't personally take aspirin for myself, but aspirin works for pain, fever, and inflammation. And if someone is having a heart attack, the single most thing that you can do to help them is give them an aspirin. So again, do you want to be ready to treat other people? If that's the case, you might pack 1 full-strength aspirin to be ready to give someone if you think they might be having a heart attack. They can get to the hospital and get to the rest of it taken care of. So considerations there, pain medications, and again, depending on what you're doing, am I hiking up a mountain doing something very active? Maybe I want to bring more. If I'm going to be sitting on a beach, maybe you don't need to bring as much. Second big class I think to be ready for is allergies, and there's different types of allergies. Are you going hiking through the Amazon where you're going to come in contact possibly with plants and get rashes? Or are you going to possibly have food allergies or seasonal allergies? The stalwart for allergy treatment had always been Benadryl or diphenhydramine. However, one of the downsides of that is that it can make you very drowsy. And I don't want to sleep my vacation away. The newer recommendations are the newer generation of antihistamines like Zyrtec, Allegra, and Claritin. And even when people come to the ER now, that's what their recommendation is that we give them because then they can also drive home. Some people like Benadryl as a multi-use thing because it can also help you sleep if people have trouble getting to sleep on vacation. So you can consider that, but I don't want to be drowsy on vacation. So I've started bringing, personally for me, Allegra. There are the 2 versions of these. There's the regular version and the version with the decongestant. Allegra D, Zyrtec D, Claritin D. The decongestant is Sudafed. That version is behind the counter. You have to show your license to get that. But this is one of those multi-purpose things where you can use both for allergy and if you have cold symptoms, runny nose, postnasal drainage, it will help dry that up. So this is a good dual-use medication. Other things, if you have a bad allergy, other stuff that we treat allergic reactions with is an H2 blocker like Pepcid. And Pepcid can be used both for allergy treatment as well as for heartburn symptoms we'll talk about. If allergies are severe, you can also use steroids, either oral prednisone or Decadron, which I'll also talk about in a little bit for other uses. this is going to need a prescription. If you have a rash, topical hydrocortisone, that's over the counter. 1% hydrocortisone you can get for rashes from plants, things like that. And then also, if you have severe allergies, like if you have anaphylaxis to something and you have an EpiPen, you definitely need to bring that. Or here's another situation. Do you want to be prepared to help others? Do you want to bring an EpiPen to help someone else? Again, it's just a matter of how much do you want to be ready for. And the EpiPen is certainly going to take a prescription, and I hear they're not cheap. Next are some different symptoms to be ready for. So nausea, you don't want to be nauseous on vacation. An easy thing to take for that, again, also requires a prescription, is Zofran. Zofran ODT, or oral dissolving tablets. They come in packs, and I usually will cut them down, these little blister packs, and I'll put them individually in my containers. And I carry a couple of these. I have them in my work pack as well. But these work great. They dissolve on your tongue, and they work really fast. So good to have something for nausea. Diarrhea. There is simple diarrhea that you can treat with Imodium and Pepto-Bismol, or are you going to have a more severe traveler's diarrhea, which is treated with antibiotics that I'll get to in a minute. Are you prone to heartburn or reflux? This is where you can carry some Pepcid and or Prilosec. Pepcid, as I mentioned, can work with both the allergy cascade as well, so multi-purpose medication. If you're not someone that has issues with those, maybe you don't need them. Now, how about some antibiotics? This is certainly going to take a prescription from a doctor, and antibiotics are not something just to be used at the simplest sniffle. You really need to be kind of educated on what you're maybe going to use these for. Again, if you're in civilization, you can maybe go to the ER in urgent care if something arises and see if they think you need antibiotics. But again, if I'm up on Kilimanjaro, no clinics up there, and something arises, I want to be prepared for something that might come up. And for me, the most general purpose antibiotic I can come up with is doxycycline. And we use that to treat urinary tract infections, skin infections, pneumonia, a lot of different things that could be used for. So that's the antibiotic that I bring. Again, talk to your doctor about this, see what they recommend. Also, traveler's diarrhea. I've experienced this on trips to Nepal and Peru and Tanzania, and it can really disrupt your trip and make your life miserable. For simple traveler's diarrhea, you can use simple things like Pepto-Bismol and Imodium, but if it's becoming worse, you treat that with antibiotics. There's a couple different antibiotic classes you can use for that. It used to be that we use Cipro, but we don't use that as much anymore. There are expensive things like rifaximin. But one of the new and I think simplest recommendations is Zithromax, 500 milligrams a day for 3 days. I can tell you from experience, I took this myself and it worked great, and there's really not much in the way of side effects, and it's affordable. So again, talk to your doctor or a travel clinic about possibility of having antibiotic for traveler's diarrhea. I also like to take multivitamins. I take those daily anyway, so I'll take a supply of those with me. And very Eastern medicine. I'm not trained in Eastern medicine, but I have a friend that turned me on to this essential oil, doTERRA On Guard. And for me, if the slightest beginning of a cold, I'll take these. 90% of the time, I don't get a cold. So anecdotal evidence, I take these. They're these little gels, and they're very easy to take. Next, let's talk some trip-specific recommendations. Now, if you're going to another part of the world, you can go to the CDC website, cdc.com/travel, and you can look up the place that you're going. And let's use, for me, Tanzania. I went there to climb Kilimanjaro. So you go here and you can scroll down. It will tell you what immunizations you need beforehand, and it will tell you what things you might come in contact with there that you need to be ready for. Also, if you go to a travel clinic, they will be able to cover all this for you. Tell them where you're going, and they'll say, this is what immunizations you need and prescriptions that you should maybe bring to be prepared for other stuff. Other considerations, are you going hiking up at altitude? Generally, people are okay to 10,000 feet, depending on how fast you acclimatize. But if you're doing Everest Base Camp or Kilimanjaro or something upwards of 14,000 feet-ish, you might consider things like Diamox or acetazolamide or Decadron, a steroid, which also can work with the allergy stuff like I mentioned before. Again, stuff to talk to your doctor about. Those are going to need prescriptions. If you're going to be doing something that is very motion involved, if you're going on a boat and you're prone to motion sickness, you can use things like scopolamine. It's a patch you put behind your ear, also a prescription. There are these patches that I got off Amazon. These were cheap, and they're patches you put them behind your ear. I took these when I went and drove cars on a racetrack, and these actually worked really well with no side effects. For a little more money, you can get things like these nerve stimulation bracelets, and that can work well. You can use these in combination, for that matter, if you want. Are you going somewhere where there's going to be lots of bugs? I think some of this is just a given. If you're going to the Amazon, bring some insect repellent or places you're going to be around that. If you're going to the beach, bring suntan lotion. Again, I think those things are kind of just given. I feel like that's not really in your medical kit, but that's something that you should be prepared for as well, depending on where you're going. Now, how do you bring these things? So for me, I used to always take this. This is actually from the fishing section at one of the sporting goods stores, and it would open up here and there's a bunch of different sections, and I would put my pills in it and just label them what they are. And really this is kind of big though, and I'm not even using all the sections of it. So recently I got some smaller stuff. I got these both off Amazon. I'll put some links down below. These have, the bigger one is 14 separate things. This opens up, and then these open up. So you just put your pills in there and then you can label them. They come with some labels, much more compact, different options. These are both identical, same company, just different sizes. So these are nice and compact. You can consider something like this. Maybe I take something like this to Florida and something like this to Tanzania. Again, it just depends on how much you need to be ready for. I've seen some people use some Ziploc bags. You can get these small Ziploc bags and label them. Just be careful how you're packing them, that they don't get crushed, because you don't want to take powdered pills. So that's why I think something like these hard-sided things are nice, and they're, as you can see, really compact. So that's the medication. Something else you might consider is a medical kit, again, depending on where you're going. If you're going hiking in the Grand Canyon versus you're going to go walk around New Orleans or Paris, going to be very different for what you might need. I have my IFAK, my individual first aid kit. I've done a video on this, and maybe I wouldn't take this as much if I'm going to Paris, but definitely for big hiking trips. I've done a video. I'll put the link up here. You can check it out. There are some pre-made kits that you can buy, or you can make your own. And this also comes down to a lot of how prepared do you want to be. If you're going hiking, do you want to take splinting material? Do you want to take stuff to be ready for other people? It just, again, depends on where you're going and what your level of risk and preparedness tolerance is. So there you go, my thoughts on different medications you can consider bringing on trips for different situations that might arise. Post some comments down below if there's anything else you think I missed or that you brought on trips that you found helpful. I will also put some links to Amazon for these small things that I bought. They're cheap, $4 or $5 if you want to pick those up. And I'll put some links to some videos up here, my IFAK video if you want to check things like that out. And I would love to have you subscribe up here and stick around. And I always appreciate you watching my videos. Enjoy your trip.